Karnataka has been seeing a reduction in the daily case numbers of COVID-19. The 24-hour figures usually are 1,000 cases or even less, a big reduction from the terrible peak of the second wave. But does that mean there is a danger of the people of the state and the authorities getting complacent ahead of the third wave, which is expected sooner rather than later? Joining us, Karnataka's Health Minister, Dr. K Sudhakar. Thank you for joining us today on NDTV. Is the state getting complacent? We have a third wave coming, but are the people and the authorities thinking that maybe the worst is over, as was the case after the first wave?
Absolutely, Maya. What the fact of the matter is, any pandemic will have a multiple waves which we have witnessed. And so as in the second wave, when we have observed in the entire country, between the first and the second wave, people became quite complacent, as you rightly pointed out, and we had to face the wrath of that in the second wave. That is one of the important aspects that we need to note on that. That is why we are not allowing any large gatherings, be it political gatherings, religious gatherings. We are trying to tell the people that the third wave may come, as according to the experts' information, their reports that they've given to the state government. Based on that fact, so we have been speaking, we have been communicating to all the citizens of Karnataka to not to be complacent. The only way to get away, escape the third wave, is to quickly get vaccination. So the 2 doses of vaccination is the key to defeat this virus.
How much will mass vaccination blunt the impact of the third wave? Is that really the big hope this time around?
Absolutely. I strongly, from the medical perspective, if I have to say, vaccine will definitely help to reduce the severity of the infection. Unless we do not know the successive waves, how severe it could be. If there are different mutant varieties which may not address to this kind of a vaccine, then that will be the only question mark that we have. Otherwise, if the mutants that we have witnessed today from alpha to gamma, and sometimes where some countries have witnessed lambda, if these are the variations that will hit the third wave, I think the present vaccines is quite effective against this virus.
And the question being asked by many people, of course, when do you expect the third wave to come?
Yeah, as you know, we have constituted public health experts in the state. We have been taking their advice since the last first wave. According to them, they say anywhere between October to December, we may witness the third wave. But according to them, if the present mutants are the only variants that is going to bother in the third wave, we should not be much perturbed because the spike would be it would be between the first wave and the second wave. The number of cases would not go above the second wave.
Karnataka has been focusing on Wednesdays each week as a real push day for vaccinations. You've been having a Lasika Mela on Wednesdays. What has the response been like to that?
Yeah, Maya. Very fortunately in Karnataka, people are very proactively they are participating. That is a very good, very good for the government, because till date we have done 75% and above for the first dose. That speaks the volume. And Bangalore is the first urban city in the entire country to have vaccinated more than 1 crore, inoculations of any city. And similarly, Bangalore urban district is the second district in the entire country after Bhubaneswar to have vaccinated its 100% population. So this strategy we have in place. because we knew there should be a definite strategy for vaccination. So we targeted the epicenter of Karnataka. The epicenter of Karnataka was always Bangalore city because of obvious reasons. There was a lot of movement from international and other states, people coming in since it is a IT capital and industry centric. So we knew that the epicenter should be addressed to. The only hanging sword for us was always the border districts which we are bordering with Kerala. So the second strategy was to ensure the maximum vaccination is done in these populations, that is wherever the border districts, southern South Canara, Udupi, Kalburgi, similarly Coorg, Chamarajnagar districts. These are the districts we addressed, and we have a phenomenal response, and we are quite aware of also the fact that there could be a small percentage, that is the last minute connectivity can be a challenge everywhere. We have seen in even in the most advanced countries that there is one population, one sect of population which strongly believes even after any kind of a medical reports, medical experts repeatedly saying and confirming that the vaccine is the only way to get away with this pandemic. But there is one section of the population who still believe that they are more immune and they are more powerful. They can beat any pandemic without vaccination. That is not the right way of approach. So we are aware that the last mile of connectivity could be a challenge. We are trying to strategize that also how to get it done.
So vaccine hesitation does still remain a challenge?
Yeah, always. It is always like that. We have witnessed in many countries, many other states as well. Even in Karnataka, it could be the last mile connectivity. It could be 5 to 10% of the population. That will be always challenge. That we need to have a different strategy, how to convince them, how to also get them into the same net.